Good afternoon. This is the House Appropriations Committee. It's Tuesday, March 17th, 2026. It's 2:45. We have been running late, so we rearranged the schedule a little bit. We are going to hear 817 now, and then H 861, which is related to establishing an Americans with Disabilities Coordinator. We'll hear that tomorrow morning at 8:45. So check your agenda on that, and then we'll go and we'll do part one of H 938, the homelessness response bill. But in the meantime, we have 837, and Katie is here. And then we'll have Nolan, and then we have Rep. Rebecca here who's a reporter on Committee on Healthcare to answer any other questions. H 817. Yes, should be on our committee page too. All right, take it away.
Thank you. Good afternoon. Katie McLean, Office of Legislative Counsel. Could I have sharing capacity on them? Please.
Sorry.
That's okay. There we go. So this is a report of the Committee on Healthcare 817. It's one section, but it does two things. In subsection B, it establishes a mental health literacy training program that allows a public school to apply to DMH for a grant to provide mental health literacy training to educators and other school personnel. The second piece is on subsection C. This is peer-to-peer mental health support. This allows a school, an after-school program, or a youth mentoring agency to establish a peer-to-peer mental health support program. The specifications are in the language. And then subsection D authorizes the Department of Mental Health to provide guidance for both of these programs. So that's what's happening in subsection D. There's a reporting requirement on both of the initiatives. And I think the language that you're most interested in is this language in subsection B, subdivision B1, line 15, to the extent funds are available. A public on page 1. Subsection B1.
Oh, there we go. Yeah, it's usually at the end, so thank you.
So to the extent funds are available, a public school may apply to the Department of Mental Health or designees for a grant to provide mental health literacy training to educators or other school personnel. And then it goes on to say what topics might be as part of this training. You'll hear more about the committee process from Representative Becco. There was some conversation about the possibility of obtaining federal grants for the purpose of funding these programs. I don't know that state money itself was ruled out. But that sort of encompasses some of the conversation that happened.
And so stay right there. And Nolan, do you want to talk about the fiscal? We're going from short fiscal notes to long fiscal notes to short fiscal notes today.
Sure. There's just a note. I won't bother posting it or putting it up on the screen. I don't think we need to. So Stady. We're both crazy right now. Yeah, it's been a long day. It's been a long week. So as Katie mentioned, section 1 states that to the extent funds are possible, public school may apply to the department or designate for a grant to provide mental health literacy training to educators and other school personnel. The bill does not include any specific appropriations from the state to DMH to award any such grants. As Katie mentioned, the bill is kind of envisioning maybe federal grants. If there are any federal grants that were to come through, they would go through the JFC process, grant approval. But the bill doesn't necessarily direct DMH to apply for grants. So it's not clear, the process for getting federal grants. And then section 1 also requires DMH to provide oversight and guidance to any school, after school program or youth mentoring agency seeking to establish or maintain a peer-to-peer mental health program, et cetera, et cetera. However, the bill does not identify or appropriate any resources to support that program. So again, it sounds like I wasn't in the room when the committee was talking about it. Sounds like they were considering more on the federal grant side, but the bill does not include any state appropriation to do this work. So I think the question is, would any of this work get done in the absence of federal money?
Right, well, and my other question is on this section requiring DMH to provide oversight. Are they expected to do something if there isn't any money for any of the rest of it? Or are they still expected to do something if somebody decides they want to start or establish or maintain a peer-to-peer mental health program if there isn't one now and there isn't any money, but somebody figures out a way to do it without us involved, is DMH automatically supposed to do that?
So this language says that they are to develop age-appropriate guidance, but it is tied that it would to any mental health literacy or peer-to-peer support program established in this section. So if there's no money to establish those programs, then there's no need for guidance.
DMH does not have to do work unless there's money.
That's how I would, but the guidance is contingent upon there being programs in place who need guidance.
Okay. Questions?
I'd love to hear from
Maybe
the
Rebecca?
member of the committee.
Yeah.
You and I briefly talked about this before and you
Why
were
don't you
saying,
come on up?
oh yeah, come on up. You can introduce yourself.
Rep. Rebecca, ranking member, House Health Committee.
Yeah, so, without any money, what's the use of this, bill?
Well, it's an on-ramp and it also is illustrating the intent that we have to kind of coalesce around guidance and strategy with bringing mental health and substance use prevention supports to youth in schools. Or after-school programs or through programs like Mentor Vermont, because what we see is a lot of segmented efforts at this, including through some federal grants that are getting to some schools. But the intent of this is to make sure that all of the good lessons learned in that are getting to every community, not just the ones where those grants are being implemented like through Project Aware. And also that, schools are made aware that there are programs. NAMI has some great programs. I know through Vermont Care Partners, you can do things like teen mental health first aid. So the intent here is just to make sure that the Department of Mental Health and AOE are lifting those resources up where available, and that as federal funding especially comes available, that they have an on-ramp to implement that quickly.
So there's a mechanism and kind of a purpose to the legislature has at least weighed in on the purpose and the focus of that kind of work if they were able to apply for a grant.
That's right. And I just want to note, not just the legislature. We had a lot of students work on this bill. And it was a priority of the American Foundation of Suicide Prevention. I have a student here with me, Addison Town, who testified on the bill, and she's a page with us this session in the legislature. So this is really well informed by a lot of people who would be impacted by the work and also doing the work.
Okay, I have Lynn and Wayne.
I go next.
You can go next.
Okay, in my experience, high school board, but not just in a high school board in our community, we had the local mental health agency, the DA, who worked with teams from the school, the guidance counselors, some of the teachers, administrators. And when they had issues, when I was on the board of the high school, there was a cluster of suicides. Very, very disturbing. It could be any school, anytime, but we happen to have it that year. The people from mental health, the people who are counselors, and all their who are charged, in fact, with the community mental health needs of the community, would work with the schools in a variety of ways, sometimes in crisis, sometimes just as a resource occasionally. How is that different? And, I know that one of the things that has occurred, this was many years ago, one of the things that has occurred is the DAs are in crisis because they can't find enough people to do their mental health counseling. And the schools are hiring mental health people and social workers to work in the schools. And there seems to be less of a community-based thing and more of a becoming focused on the schools and doesn't really integrate the community and the families as much as it probably did under the teams scenario. Is that something that you heard any testimony on, or did you get any?
So that is really related, what you're talking about is actual mental health services. What this is mental health literacy, like improving literacy of teachers and staff at the school. Because right now they're facing all of these youth who are living through a lot of challenges. And not all of our teachers and school staff are trained with how to respond to those and connect those youth to resources like a clinician. And then the peer-to-peer part of this bill is about creating space for youth to talk to each other and connect. And it's not clinical, it's not even overseen by a clinician from a DA. And that's intentional because we're seeing a lot of really promising outcomes coming from peer-to-peer counseling in schools across the nation. Vermont has a couple pockets of this. And like I said, a lot of these approaches are segmented, so we're not sharing the lessons learned. And the intent here is to really do that.
I'd sort of like to follow up. That
Okay.
in our school, now we were a big school, depending on one school. We had peer-to-peer, we had guidance counselors who were doing group therapies, we had teachers who were guidance counselors who were training teachers and parents, doing things through the mental health agency in the evening. I mean, there's a lot of these things that have been done. I'm just curious as to what kind of research do you have that this is now not being done, or where is that need? Where is it evaporated to?
So I think, again, you're through the DAs. So that's through a contract, which is limited in scope, time, money, right? So if like my school in Winooski, we're down to, one counselor right now for 700 kids. So my kids' counseling is cut back. And that's happening around the state. And so we're limited in that capacity. And this is also, it's not clinical in nature. It's about connecting people. What we know about mental health is a lot of it is just people need to connect with each other, not, this. And so sometimes it's just kids getting together in an after school program and making, bracelets. I saw they did this at my school with, I don't know if it was, I think it was Mentor Vermont. There's a program, oh no, it's Vermont After School. They have a program called Dream where they just get kids together. They have someone who has done some sort of mental health literacy program. All they're doing is connecting those youth to resources. We don't have capacity to give them all counseling. We have capacity to connect them to other resources. Because remember, there's a spectrum of mental health issues and not everyone needs in-depth counseling, and they need prevention though. And this is prevention.
Does this include advisories?
What do you mean?
Advisories they would create. This is not homeroom. This is a group of students heterogeneously grouped together. They all get together. This has been done for 10 years at least in Vermont that I know. You go and you have an advisory, and your teacher, the homeroom teacher, basically connects with the kids. They all interact together.
Yeah,
They do
so
something that is not just academic or just not taking attendance, but and a lot of schools have been instituted advisories. This was supposed to be a way, from what I understand, and I believe it was done, like I say, back in 2015, or certainly in statute, put in statute, a miscellaneous ed bill, that you would have a way to identify students with issues. This is during the course of when school shootings, and you could identify things that needed to be taken care of, and then they could be quietly referred out. If they need it, but it was really a way to interact with kids of a broad social economic background, broad group, and have them interact together. I mean, I know that they have a lot of values that educators talk about them recently, so.
they're not being done through the Department of Mental Health, and they're not being done in a way where we are actually looking at lessons learned and doing any kind of cross-system learning and capacity building.
Okay, thank you.
Plans change. Wayne, do you have a,
Yep, therein lies exactly the last night I took a look at it. And I think something's changed since last night, because last night it.
we're hearing that things are tough a little louder.
So last night when I read it, it said something to the effect that a school can pick a program. That suggested to me that the programs could be all different. And I didn't like that idea. I think we should be, follow up on your idea that we need to be able to track and be able to determine which things have good outcomes and which things don't work so well. But you need to have some consistency. So you need to have come up at least, if not be really specific about the program, at least have an outline of the programs that address specific issues within those, so that you have apples and apples as you go forward to try to learn the best practices for forward. Unless other states have had something really successful that you could bring up. But who's going to do that? Is that Department of Mental Health going to try to come up with some?
They did, and
They already have?
they're in this bill. Yeah, I worked with them on this, and they came up with what, would be age appropriate for, middle schoolers and then high schoolers, and sort of the, recommended things that should be addressed. And many of those things, what we heard in testimony is many of those elements that should be addressed with youth to support them and adequately prevent them from using substances and having mental health crises are things that are contained in existing trainings that we have here in Vermont through organizations like NAMI, Mentor Vermont, Vermont After School, and others. So it's not like we need to reinvent the wheel, but it also, to your point, gives local communities the ability to choose what's right size for them.
It should be, I understand it could be dispersed places, but one document, everybody gets the same document. Here are the recommendations, what you should do.
I think that would be an RFA, where the department, because it would be a grant program, the Department of Mental Health would, upon receiving funding, would draft an RFA and post that, and they would really articulate the specifics of what they're looking for.
Okay, so I think you'll lose something if you let them all choose. We have 6 accounting systems in the schools. We've got, I don't know how many grading systems in the schools. If we create something else that is allowed just by the folks out in the schools that are going different directions, we're not going to get there.
Other questions? Concerns?
I'm good with this.
You're good with this?
I'm good with it.
Okay.
It's just
So,
going forward.
yeah, so there's no money. I'm trying to move bills where we can. Did we say possible vote on this? Okay, there's no money. If there is money, then there's sort of a plan. I would like to vote this out if people are ready to vote this out. Everybody okay with that? So,
I'll move.
okay, thank you. Okay. The team here, and it's as amended by Committee on Healthcare. Lynn?
John, you second.
Yeah, I think that this is a very worthwhile idea.
Uh-huh.
I think it's already being done in some places, maybe not all places. That might be something. I don't know the mental health agency is the place to coordinate it or do it. I think a lot of schools have been dealing over many years with trying to figure out how to connect their administrators and their teachers and everyone, how to connect with their students on a one-on-one basis.
Yeah.
So that they would know, but they would know, they would have an adult, every child would have an adult that they could relate to and know. And this has been done for many, many years, often with guidance counselors who also.
Depending upon the school district, yes.
Well, a lot of different schools. And advisories is one way that has been, actually, I put a piece in the education miscellaneous ed bill years ago. And it was put in, and it's in statute somewhere. And I think a lot of schools have been doing it. So I mean, it's not gonna take any money. I don't know that it's gonna. But I don't think you need money to do this. I think that we can go and work another way to get this on the back.
And that may happen as well.
Yes.
Okay. If the clerk is ready, let's call the roll, please.
Representative Bloomley,
Yes.
Representative Dickinson.
Yes.
Yes,
Yes.
thank you. Representative Feltus,
Yes.
Representative Kaczynski.
Yes.
Representative LaRoche. Yes. Representative Rowicki,
Yes.
Representative Nyland,
Yes.
Representative Squirrel, yes. Representative Stevens.
Yes.
Representative Gacaboni. Yes. And Representative Shaw.
Yes,
11-0.
thank you. And what was the vote out of healthcare?
11-0,
11-0.
10-0-1, I believe.
10-0. Okay. Great. So we'll send this off to Nigel, the TIF will be this reporter from us. And that means it would be on the fourth Thursday and Friday. That was tomorrow and fourth Thursday and Friday. Great. Thank you very much. All right, so committee, we have one more bill today and it's the big one.
Just kidding.
And I think we have a few minutes.